Hey everybody, it's Heather from One-to-One Physical Therapy. I recently did a video about how to chew properly, and after I did this, I realized I should have done this video first because this video is going to talk about establishing balance and good alignment in your jaw joints in order for you to chew properly and three-dimensionally. So many of you who have significant TMJ dysfunction, headaches, neck pain, jaw pain, probably can't go right ahead into chewing mechanics because you need to establish your foundation first and create better balance at your jaw joints. In some cases you may, but in some cases you may not. So that's what this video is really designed to talk about. So we're just going to go through the anatomy of the jaw first. And here is our skull. Here's our mandible. I am going to take off the maxilla so that we have our sphenoid and our two temporal bones. And your temporal bone is the seat of your jaw joint. It's the foundation for your jaw. And if your temporal bones are not in alignment and there's twist and torque in these bones, your jaw joint is not going to be aligned, and you could have pain and dysfunction at the jaw. So I want to talk about what influences the alignment of these temporal bones. From a dental perspective, your occlusion and the balancing of your bite, the alignment of your bite, absolutely can influence these temporal bones. But what's often underappreciated is the impact that everything below, from your foot, your pelvis, your rib cage, up into your neck, can influence your jaw joints. And the body is inherently asymmetrical by design. And this is one of the tenets of the Postural Restoration Institute, which is the method that we use at this practice when looking at the body from a physical perspective. And one of the big reasons why our bodies are asymmetrical by design is that our diaphragm, our breathing muscle, is bigger on the right, has broader attachments to the spine, is thicker relative to the left. And what that does is it creates this twist and this torque where our body is oriented more to the right. So in order for us to not be walking around sideways and clockwise all the time, which if you blindfold people, they will start to do that. They've done some experiments with that where people will naturally walk clockwise. And so in order for us to not do that, our visual system orients us so that we're straight. So if you just stand for a moment, just stand what your brain thinks is straight, and just feel the front of your ribs. Put your hands on the front of your ribs and look down, and just notice if one hand is more forward than the other hand. And most of you will find that your left side is more forward than the right. Another way to look at this is to lay down on a bed or a table and place your hands there, and 99% of you, this should be more forward on the left relative to the right. And the reason is because of that asymmetry. So how this influences your temporal bone is that when you're oriented to the right, your upper torso is going left. What that's going to do is it emphasizes more opening on the left ribs and more closure on the right. So what that means is it's harder for you to inhale, to take air in on the right side relative to the left, particularly this upper apical area. To compensate for this, your accessory neck muscles for breathing start to kick in. Those are your scalenes and your sternocleidomastoid, and perhaps some others as well. But I want to really emphasize the sternocleidomastoid, because the sternocleidomastoid attaches to the mastoid process of the temporal bone. And when that right sternocleidomastoid is working harder relative to the left, it's going to relatively rotate that temporal bone posteriorly. And that's relatively going to create some jamming or compression in that right TMJ. Another reason why that right sternocleidomastoid SCM is going to be more active is that the head is relatively rotating to the left, and that's generated by the right SCM. So that right SCM is working harder to help you breathe, to help get air in, and also to just rotate your head to the left. On the left side, the opposite is happening. The temporal bone is tending to rotate more forward. And what that does is it's going to gap that left TMJ joint. So on the left side, we tend to see a little bit more anterior disc displacements. The other thing that happens is that as the temporal bones shift, the jaw shifts. And a lot of times the jaw is going to be rotating to the left. And this is a little opposite in this camera video. But generally speaking, the jaw deviates to the left. And a lot of that is driven by what is happening below. So anytime we're dealing with TMJ issues, headaches, neck pain, the jaw is always going to be implicated somehow. And addressing these factors of what's below and how it's influencing above is just as important as addressing sometimes the occlusion and other factors that may be happening more specifically in the cranial system. So one question that you might be wondering is, if this asymmetry is normal, why do some people have issues with it and others not? And what we tend to find here is that the more stress, cumulative stress, that a person is experiencing, the more locked up and twisted and torqued the system becomes. And this can be physical stress, mental, emotional stress, even physiological stress such as toxicity. The system will lock up and tighten up, and it goes into this protective, survival-oriented place, because the body feels safer and more comfortable on the right side of the body. So concurrently, we have to also consider all these sources of stress that are leading to and contributing to this pattern of torque and twist. So it's a complicated picture, but we sort of need to keep these things into consideration and addressing them as a prerequisite in a way before we have the ability to start moving our jaw three-dimensionally to chew properly, as discussed in that other video. And we're going to create another video to give you, to teach you an exercise that will help you kind of de-rotate your body so that you can be in more alignment. And hopefully that will help. Thanks for listening. Have a great day.